Talking Orthodontics, lecture number 14. Orthodontics is the dental specialty that focuses on the growth and development of dentition and its surrounding anatomical structures. This specialty deals with the prevention and correction of dental and oral deviations. So we're talking about the way the teeth come together. Orthodontists usually limit their practice to correction of malocclusion and straightening of teeth. There are many reasons why someone would need orthodontics, but we're going to talk about some genetic malformations that increase the need for orthodontics. So we have jaw and teeth discrepancies. This is a difference between the size of the upper and lower arches, or between the jaw and the size of the teeth. We also have facial and palatal clefts. This is a birth defect that affects the upper lip and the roof of the mouth, and some of these patients are born without some of their teeth. We can have patients that have a tongue that's too big or a tongue that's too small. And then we also have development of muscles of the frenum. And frenums are little fleshy pieces of skin that attach or connect different tissues together. They can sometimes be too tight, like the frenum that connects the tongue to the floor of the mouth. If it's too short, that person would be tongue-tied. Or someone with a really thick labial frenum between the two front teeth, they could have a space between their teeth. So these are all reasons sometimes that orthodontics is needed or some sort of intervention is needed to help these issues. There's also systemic influences like infectious diseases, endocrine disturbances, and nutritional disturbances that play a huge role in how the teeth develop and function. For instance, a high fever during tooth development can affect the tooth bud formation, and the child could be born with malformed teeth. We also have problems that can sometimes creep up when there's an early or a delayed loss of a baby tooth. So on one side, if like a baby tooth is lost too early, that tooth is maintaining the space for the permanent tooth. So when the permanent tooth comes in, there may not be room for it if that baby tooth is lost too early. There's also permanent teeth that try to erupt too early. That can pose a problem as well. Or early loss of permanent teeth. If a tooth needs to be pulled for whatever reason, the teeth surrounding that one tooth that's been pulled will start to shift as well. Periodontal problems. So if there is bone loss around a tooth, that tooth is most likely going to start shifting and moving, and then that will affect the way that the teeth are coming together. We can have cysts or intraoral growths, injuries, trauma, and then just bad habits like thumb sucking or tongue thrusting. We're going to go into a little more detail on some habits that can influence the development of the dentition. So let's start with thumb sucking. If the patient quits sucking their thumb prior to age 5, there's usually no permanent defects. After age 5, though, we will start to see defects of the palate, the maxillary arch, and the anterior teeth. Tongue thrusting is pressure on the patient's maxillary anterior teeth each time they swallow. So instead of pushing off the roof of their mouth, they push on those front teeth, which actually causes the front teeth to kind of flare out. And then bruxism is an involuntary grinding or clenching of the teeth, and it does cause the teeth to wear down prematurely, which changes the way that the teeth come together. And then mouth breathing is a big one. This can cause a facial distortion due to narrowing up the dental arches. So occlusion and malocclusion, the entire form and function of the face and its structures are directly affected by the manner in which the biting surfaces occlude. So the development of occlusion is an ever-changing process that continues throughout life. There's always going to be changes. So patients that have had braces should wear their retainers forever. Some patients that never had braces, they may actually develop a need for orthodontics later in life. It's always changing, so that's something to keep in mind. In ideal occlusion, this is important to know, the maxillary teeth are in maximum contact with the mandibular teeth. When in maximum contact, there is a 2 millimeter overlap of maxillary anterior teeth over mandibular anterior teeth. Maxillary posterior teeth are one cusp buccal to the mandibular posterior teeth. Centric occlusion is maxillary and mandibular jaws are closed and the teeth are in maximum contact. That's important to remember. And then with malocclusion, malocclusion is any deviation from the normal pattern of occlusion. And the problems with malocclusion are it impairs mastication. So chewing is not as easy for somebody with ideal occlusion. It also increases our susceptibility to caries. So we have a higher risk for developing cavities. And then it increases the incidence of periodontal disease. Teeth that are crowded together are very difficult to keep clean, and so the incidence of disease goes way up. And then it can also lead to early tooth loss, and it can cause abnormal respiratory habits, which this is a big issue up and coming with sleep apnea. So these breathing issues are something to pay attention to. And then it also can affect self-confidence in relation to facial aesthetics. There's a huge influence on a person's confidence if they don't have an ideal smile. And then last but not least, it can affect speech. So there are main issues with occlusion that we want to watch. So conditions of malocclusion can be overjet, overbite, open bite, and crossbite. These are important definitions to remember. So overjet is a horizontal distance that exists due to the protrusion of the most anterior maxillary incisors at the facial aspect of the most anterior mandibular incisors. Overbite is a greater than normal vertical overlap between the incisal edges of the maxillary central incisors and the mandibular incisors. A normal overbite exists when the maxillary incisors overlap the incisal third of the mandibular incisors. Open bite, there is no overlap. Rather, there's an open space between the incisal edges of the maxillary and mandibular incisors, while the posterior teeth are in occlusion. So this basically means when you're biting together, the front teeth don't touch at all. This is typical in thumb suckers. Sometimes also tongue thrusters can have an open bite. Crossbite occurs when the maxillary anterior incisors and/or the posterior buccal cusps are in lingual eversion, they're turned towards the lingual side, and they don't overlap the mandibular teeth. So the maxillary teeth should always, when you bite together, be on the outside of the bottom teeth. And if that's not the case, that's a crossbite. So those are things to watch for, kind of get familiar with, and help the dentist recognize these issues early on and maybe make that recommendation for an ortho consult. Or if you provide Invisalign in your practice, this is something that you'll want to know really well. If you have any questions, please reach out to one of your instructors and hopefully you can have clarification. Thank you.